Hello, my name is Alethse de la Torre Rosas, and I'm the General Director of the National Center for the Prevention and Control of HIV/AIDS, CENSIDA, at the Ministry of Health, Mexico. First of all, I'd like to thank the organizers for their invitation and the opportunity to share with you our perspective at this important forum. It is an honor to be here with you today. When we think about the strategies for rallying support behind HIV responses, in particular strategies that are led by gay or bisexual men, people who use drugs, sex workers, and transgender people, we necessarily need to discuss why this is important for the HIV global response. Around the world, healthcare systems are struggling with rising costs and uneven quality. Healthcare leaders and policymakers have tried different strategies, such as enforcing practice guidelines, reducing errors, attacking fraud, amongst others with limited impact. We are far from reaching our goal of ending the HIV epidemic. Gay and bisexual men, people who use drugs, sex workers, and transgender people are among the remaining groups for whom HIV is uncontrolled across the world. For instance, men who have sex with men are more likely to be living with HIV compared with people in the general population in low and middle income countries. And transgender people have lower survival rates than other groups. In addition, criminalization, discrimination, and sexual stigma that the LGBT community, as well as people who use drugs and sex workers face on a daily basis, limits the provision and uptake of HIV prevention, treatment, and care service, which leads to worse outcomes, therefore increasing inequalities. The inability to deliver programs that are tailored to the needs of these communities threatens to reach global, regional, and national HIV targets. Trusting healthcare systems is based on the assumption that the person's best interests are being considered during the decision-making process. However, although people and community-centered care is becoming a widely used concept in medical settings, it is poorly understood and often neglected. People-centered care implies that the patient's values, needs, and preferences should help guide the clinical decisions and programs. To meet the UNAIDS targets to end the AIDS epidemic, we need to deliver programs that are acceptable to communities. It is time to stop doing everything for communities without actually including them. People living with HIV and the key populations are the only ones who can genuinely identify from their own personal perspective which health outcomes are essential for them and evaluate if these are being achieved by the programs installed. After all, they are the ones experiencing the various challenges, the health outcomes, and their impact in every aspect of their lives, 24/7. Exclusion of gay and bisexual men, transgender people, people who use drugs, and sex workers from participating in national AIDS planning programs and HIV community-led responses can result in national plans that omit or neglect their needs, which in turn contributes to the lack of funding and inaccessible or poorly targeted programs. The inclusion of communities and increasing peer support can potentially help to increase adherence, retention in care, virologic suppression, and therefore to reduce the transmission, strengthening the HIV treatment cascade. On the other hand, not taking into consideration people's needs can lead to barriers to receiving their treatment and loss of follow-up. From the government's perspective, we need timely and reliable information to maximize the efficiency of our interventions. There is no way of achieving value for healthcare other than having communities' voice at the center. And this is another area where the communities that are most affected need to not be left behind. Community-led responses can help national programs and health institutions to identify persistent problems, barriers, and solutions that are adequate by helping to monitor their outcomes. Community-led responses can reach geographical regions and people that the majority of healthcare systems have no access to. There's huge room for improvement in defining value and co-creating meaningful metrics and registries from a broad, plural perspective involving people and communities, in particular for those who have not yet been reached or for whom their policies are not working. Investing in HIV responses that are led by the most affected communities, gay and bisexual men, people who use drugs, sex workers, and transgender people, can help to generate programs that bring value for all, and this can be measured, such as appropriate care in order to achieve people's personal goals, achievement of best possible outcomes with available resources, which is the technical value for healthcare systems, fair resource distribution across all patient groups, and contribution of healthcare to social participation. By involving community partnerships, it is feasible to create mechanisms to facilitate key populations' feedback on services and programs. They help to create social networks for those already marginalized to improve accountability and responsiveness and implement comprehensive and quality HIV services. Community involvement can be of great value, allowing for optimization of local resources. By sharing data and insights, providers, governments, and communities can learn from each other, motivate participants, and facilitate changes for the implementation of policies. Why would we support HIV responses that are led by gay, bisexual men, transgender people, people who use drugs and sex workers? First of all, because it's the correct thing to do. No one should be left behind. And secondly, because it's a strategy in a world with limited resources that will help to transform healthcare systems and make them more efficient and reduce inequalities. We can maximize our results by investing in the groups where the epidemic is not controlled and focusing on partnerships that bring the prevention strategies and healthcare to where it's needed, alongside programs that are acceptable and adequate to these communities. In doing so, we will achieve our goal of offering true value to all peoples and communities. Thank you.